Hi, my name is Emily Flood and I'm a student at Bradman University. Today I saw a patient, 28 years old female, came in reported that she has been struggling with fears of leaving her home and interacting with others on account of her anxiety about coming into contact with germs and illness. She explained that her difficulties become intense over the past year that she had to leave her job. She reports that she had to wash her hands several times a day, as much as 50 times a day. In addition to her fears of contamination and illness, the patient also reported increased sadness and depression since taking her leave from work. She stated that at present her symptoms are making it difficult for her to walk, be, be with others, and enjoy usual activities. Her current symptoms appear to be a contamination of her emotional reaction to the trauma of losing her young child in tragic accident and subsequent delusion of her marriage in the wake of their loss. She stated she is seeking therapy to help address her germ phobia and depression in conjunction with her psychiatric treatment at local clinic. The patient arrived early to her session and apologized for ringing the doorbell a number of times. Doris, is it okay if I call you Doris?
Yes, you can call me Doris. I want to apologize for ringing your doorbell so many times.
It's okay. Please have a seat. I will start by saying that this audio recording will be submitted to Bradman University, which is my school. Do I have your consent to continue with the recording?
Yes, you have my consent.
You are here today for obsessive compulsive symptoms. I am going to start you on a specialized type of cognitive behavior therapy. This is a therapy that helps individuals cope with and change problematic thoughts, behaviors, emotions, depressive effect, and agoraphobic reaction of obsessive compulsive symptoms. This therapy plan will consist of three therapies: exposure therapy, self monitoring, and habit reversal training. This cognitive behavioral therapy will be done here in the office as well as at home. Next, I will explain in detail about each therapy, but before I move on, do you have any questions?
No, I don't.
Okay. Cognitive behavioral therapy, um, also known as CBT, are designed to break the association between sensations of distress, object, situation, or thoughts that, that produce distress. These therapies will break the bond between feelings of anxiety and ritual behaviors. Today, today being our first session, I would like to start you with the exposure therapy. Exposure therapy is a psychotherapy of choice for the treatment of your OCD condition. This therapy involves confronting feared objects and situations in real life. One of the behaviors you express is the need to wash your hands several times a day because of your anxiety when it comes to being in contact with germs. On average, Doris, how many times a day do you wash your hands?
Approximately about 50 times a day.
In those 50 times, how often do you say that you actually come in contact with the germs?
I honestly don't know. I just feel like my hands are dirty and have germs, and I just accept it and I just go ahead and wash my hands.
How are you when you use the restroom?
Oh, the restroom. Public restrooms are the worst. My anxieties are always skyrocket. It's very difficult for me to walk out of there without being very anxious.
Thank you for sharing, Doris. The exposure therapy will help you with the discomfort that you have. It will also help decrease your anxiety. What I want you to do is visit public restroom Stay in for roughly 30 minutes. Do not wash your hands. You may feel very uncomfortable, but I want you to push yourself. After 30 minutes, record your anxiety level, low, moderate, high, and you will repeat this every day for 2 weeks. Each day, if you can. I would like you to increase the time. Do you have any questions?
Doctor, I don't think I can do this. Just the thought of it is causing my anxiety to elevate right now.
Do you have anyone that lives at home with you?
I live with my twin sister.
It would be good for you to ask your twin sister to join you to provide support. We will meet we will meet in the office in 2 weeks for our second session. If you have any questions during the 2 weeks period. Hi Doris, welcome back. It's been 2 weeks since our first session. Please have a seat. How did the exposure therapy exercise go?
Um, so the first time it was a bit difficult for me. I struggled with just the germs all over the place and all over me, and I was really pressed to wash my hands. But as you told me to bring my twin sister along, she helped me cope and she helped me really overcome and push towards the 30 minutes. And so I was able to make it through the 30 minutes. But by the second and third time, as I did this exposure therapy, it became a little less difficult.
How would you rate your anxiety level with your first attempt?
My first attempt, I would rate it at a high, but then over time, as I said, it became less difficult, so then it digressed to my moderate.
Okay. As you repeat this exposure task over time, this gradual exposure and delayed response will help you to learn to control your fear of germs. Today, we are going to implement another CBT which you will practice at home alongside the exposure therapy. This therapy is called a self-monitoring and mentalization therapy. With the initial session, even though Doris was very early to her appointment and apologized for ringing the doorbell number of times, she seems very overwhelmed, nervous as she struggles to find words to describe her situation. But with encouragement, she was able to be at ease. And hopefully, her second and third session, I hope to see her appear, because today she appeared somehow more relaxed and was able to engage more easily. As we all know, cultural diversity plays a role. Behavioral patterns that may seem dysfunctional to clinician may be within the expected norms for the client's culture. Therefore, clients who initiate treatment with a therapist from a different group may encounter misunderstandings. A client's unfamiliarity with the social conventions may be mistaken for pathology, and the therapist may encourage the client to adapt the dominant culture's common sense beliefs and life goals, which might be inappropriate or irrelevant to the problems for which the client is seeking therapy. Doris, we're now going into the second session. And as we go into the second session, I'm going to explain to you what self-monitoring and mentalization therapy is all about. And I expect you to practice that together with your exposure therapy. With the self-monitoring and mentalization therapy, it involves mentally visualizing and monitoring yourself in a feared situation or visualizing the consequences of a feared situation. An example would be you're gonna visualize yourself driving on the road and hitting a pedestrian, and you in an imaginal exposure you create in your mind detailed images of the disaster you feel will occur if you do not avoid or ritualize as its actual exposure. Also, it is helpful to meet others with similar difficulties for support and advice and social contact. These therapies are usually run by people with the disorder. What I mean is meeting people that have suffered from that disorder. I mean, a group of people that have suffered from from the disorder. You usually gain a lot from them for with the disorder. Sometimes again, your caregiver or your families could be of help to you in a group. Some groups also have professional support for some of their activities, such as providing information. Or another therapy we can do is, as a healthcare professional, I will provide support and guidance and encouragement with the use of self-help manual and work with you either face to face or by the telephone or by the computer. At home, I want you to picture yourself walking in the divert manner for several minutes every day and record your level of anxiety. As, as you get used to the discomfort with distress, anxiety over time, you are gradually desensitizing to the feared situation, making you more willing to move the process to and a real life and engage in the next step, which is the exposure ritual prevention. Will you promise me you're going to do that?
Yes, I can.
Hello, Doris. Glad to see you back after another whopping 2 weeks. How have you been doing with your exercises? How many times a day did you do the exercise, and where do you rate your anxiety level during the exercise?
Hi, Dr. Mose. I was able to do the exercises at least 3 times a day. And overall, I can rate my anxiety level as mild during the exercises.
Great. With the mild anxiety, what did you do and how long did it take you to calm down and resume your normal self?
It took me a few deep breaths to allow myself to relax. But overall, it took about 10 to 15 minutes.
Now, since we have and are making giant improvement, we can now implement our third therapy session, which blends into the therapy performed in the second session. At the end of the session, since you are doing well, our next session will be scheduled a month from today, but you still have to continue with all three therapies several times today. Are you okay with that?
Yes, that will be perfect.
The third therapy we're going to do today is called habit reversal training therapy. And what this includes it gives you it's an awareness training, introduction of a competing response, positive reinforcement, and often relaxation technique. It focuses on the sensation of the body and specific muscles before and while engaging in the behavior, and identifying and recording when the habit occurs. These techniques increase awareness of how and when urges develop, making it is more likely that an individual will be able to intervene and make a change. This therapy deals with the patient's reframing from ritualistic behavior. An example will be so what I'm going to ask you to do today is when after you finish cooking in the kitchen, um you have to leave the kitchen without cleaning or touching any, or when you touch the floor, don't wash your hands for a little while or for a long time. This is the end of our therapy session. Today, the third therapy, let me reinforce. The third therapy, I want you, when you go home after you're done using the kitchen, don't clean the kitchen, don't clean your stove, And if you have to clean the floor, and don't wash your hands up. Wait for maybe at least 15 minutes before you wash your hands. So this is the end of our therapy sessions. I will briefly summarize that we have done what we have done throughout this time with our sessions, and answer any questions or doubts you might have. And we have to decide subsequent schedules after today. I really think you are improving greatly, and extending the schedule to every 2 months will be great. Is it okay for you?
Yeah, I really feel a lot better, and I also think every 2 months will work for me. But I can call you early if I have any problems.
In summary, we have covered three different therapies which you are required to do at home. Exposure and ritual prevention may be difficult at times. It takes hard work to confront the situations that you would usually avoid. However, in order to reduce your OCD, you must practice exposure and find out that anxiety and distress will decrease without rituals. As you practice exposure, these exercises become easier and easier, and your urges will ritualize and will decrease. So we have also decided that we will meet again here and see how we're doing with the therapies or exercises in the next 2 months. Thank you, and you have a blessed day.